When your eyes are itching and irritated, it can affect everything in your day. But if it lasts several days or maybe even months, you could be suffering from dry eye. When eye drops aren't enough, head over to the Dry Eye Institute and they'll take care of you. Take a look.
Okay, I'm here at Eye Associates of Fort Myers, which, by the way, has been owned by the same family for 50 years. Recently, Dr. Stephen Smith started the Dry Eye Institute. I'm with Dr. Kaplan now, one of the eye doctors here. And dry eye is something a lot of people are dealing with, but they might not know exactly what's going on or how to treat it.
Dry eye has been a long neglected, debilitating eye disease. And meibomian gland dysfunction is one of the leading causes of dry eye.
Okay, so what's a meibomian gland?
So upper and lower lids, there's approximately 25 to 30 in each. And every time you blink and the lids come together, that squeezing action allows the oils to secrete. That's the top part of the tear film.
And then from there they get clogged, right? And that's kind of one of the ways dry eye, you start feeling that.
So if there's not enough oils in the tear film, then the other parts of the tear can evaporate too quickly. So areas that are clogged, there are ways to help get those unclogged and flowing more properly.
What are some of the symptoms, I guess, of dry eye? Because we don't know when our glands are clogged, I don't think.
Well, the tear film is one of the more important aspects of vision. As light enters, it's the first refractive element. So if there's low tear film and the lids are rubbing on the eye, you can get scratchy, itchy, redness, soreness, pain, fluctuating vision.
All right, so this is Cindy. She is one of the certified laser specialists here at the Dry Eye Institute. So talk to me about what's happening here. Ed looks very relaxed and while Dr. Kaplan gets ready to do this procedure.
He should be very comfortable. He is in a large massage chair. First thing we're going to do is put some numbing drops in his eyes so that he's not going to feel any discomfort. And then I'm going to hand these little things to Dr. Kaplan. It's like a contact lens that covers over the eyelids, and it wraps around the eyelids. Once it's going to heat and massage the eyelids.
Wow.
We usually tape it into place because these little guys can have a habit of wandering off.
So what exactly is happening there? It's heating so that those glands are able to relax and open up? I mean, what's exactly happening from the heat?
The oil in the glands gets thick. It's like having a toothpaste come out of your lids. It should be like a clear vegetable oil, but now it's thick and it's nasty. What do you do to make oil softer? You heat them up. It's just like your vegetable oil. So we heat them first and then slowly massage it, and it will help to work out those oils. I'm just going to start it right here because we've got them all set up. And he's going to feel some heat come in for the first few minutes, and then it's going to start gently massaging his eyelids.
And then how long do the results last?
We've had people report that it lasts for years. Others want to do it every 6 months.
We're also talking about something called IPL. It's another treatment that you do. What is IPL?
IPL stands for intense pulsed light.
Okay.
It's similar to a laser, and it's used to clean out the glands, essentially.
And I understand that this kind of dry eye, if you don't get it taken care of, the damage can be irreversible. I mean, we're looking at some images here. Show me what we're looking at here.
Well, when you look at the images on the LipoView machine that we have now available, the normal glands will be like the ones on the left. And they're nice and thick and full and long. There's a whole bunch of them. They fill up the whole lid.
Right.
That's how they should look. If you look at the ones on the right, they're getting all twisted and there's holes and they're knotted. And if you do not do anything to help those glands, they're only going to get worse.
All right, so Ed, don't fall asleep here because we're not done with the segment yet. But I do have to tell you, if you are suffering from any of the symptoms that you heard Dr. Kaplan talk about, what dry, itchy, pain in your eyes, make sure you come see Dr. Kaplan or Dr. Smith here at the Dry Eye Institute. They accept most insurances, and the info is up there on your screen.